New York's Governor Andrew Cuomo has been praised for his leadership during the COVID-19 pandemic, but his actions leading up to the crisis are now coming under scrutiny. California, which imposed lockdown orders nearly a week before New York, suffered a fraction of New York's death toll. While nearly 29,000 New Yorkers have died from the coronavirus, the death toll in California is just under 4,000. A new piece in ProPublica takes a look at how officials in both states responded to the pandemic much differently. One of the co-authors of that piece, Joaquin Sapien, joins me now. Welcome, Joaquin. Thanks for being with us. We really appreciate it. Why did New York's decision to shut down lag so far behind California's?
What we found was that there was a lot of infighting between the city and state that really slowed things down pretty dramatically. And another crucial aspect of it was the sort of input of the people who know the spread of virus best, being epidemiologists who had studied it for quite some time. If you look at what happened in San Francisco and California, you'll see that leaders there relied on their experts to a degree that just didn't really happen in the early days in New York City and state.
And I want to get back to that infighting you mentioned in just a moment. But first, one of the more specific areas that Governor Cuomo has been criticized comes here, where a significant number of deaths from COVID-19 occurred in nursing homes. And Governor Cuomo was criticized for a since-reversed decision which allowed elderly people suffering from the coronavirus to be returned to their nursing homes. Now, Governor Cuomo blamed the federal government for the guidance. And I want to play a clip of the governor addressing exactly that. Let's listen.
Why did the state do that with COVID patients in nursing home? It's because the state followed President Trump's CDC guidance. So they should ask President Trump.
Does that response square with what you found in your reporting?
Well, we didn't explore the nursing home issue as closely as some of the other concepts that led to the delay. But I think what's interesting about that statement is that, early on, Governor Cuomo also said that COVID-19 will spread like wildfire inside of these nursing homes. And then so to later implement a policy that, essentially forces these homes to take in COVID-19 positive patients doesn't seem to quite, square with that early concern, which he clearly had. And if I'm not mistaken, there was at some point along the way some confusion about whether or not, his own health department had even issued that. He wasn't necessarily aware of it when he was first being asked about it in some of those early press conferences. So that's something we're exploring a little bit more deeply now. Obviously, the nursing homes have taken a huge hit, with more than a third of all deaths, I think, taking place in nursing homes across the country. And any state official should have been pretty well aware of that, based on what was happening not just in this country but all over the world. I mean, COVID-19 has affected predominantly elderly people from beginning in Wuhan and in Italy, and we know that it travels fast in congregate settings, which nursing homes are. And so, this idea that anybody was blindsided by the fact that COVID-19 would spread quickly in a nursing home just doesn't comport with the facts as we know them now. That's been established for quite some time.
And now I want to go back to that earlier mention you made about the crucial relationship between city and state governments. In your article, you write about San Francisco Mayor London Breed's relationship with Governor Gavin Newsom. Newsom was San Francisco's mayor just before becoming governor. So if you would, compare their relationship to the one between Governor Cuomo and New York City Mayor Bill de Blasio.
Sure. So, I mean, the way that it was described to me by Mayor Breed when I spoke to her for the story was that, it's a much more collaborative. She used the word collaborative to describe it. It's a more supportive relationship. Newsom and Breed have some history going back several years. He appointed her to one of her first city commissions back in 2010, in the final year of his tenure as mayor. And so, she turns to him. They share policy ideas. They share at least one staffer who used to work in her office and now works in his office. And so, the two of them were able to move with a little bit more, they were able to move in a way that was more in sync than what we saw out of New York with Mayor de Blasio and Governor Cuomo, who have, sort of a notoriously, sort of conflicted relationship, combative even.
And did you find that combative or difficult relationship, where does that stem from? The fact that both of them have sort of national political ambitions, you think?
I think that's part of it. I think it's just gone back, several years now. What the roots of that animosity are, I'm not really sure. But we certainly saw evidence of it in our reporting. I think early on, the city and state were working together pretty closely, but at a couple of crucial moments, it really splintered. And, those moments being around the most important things, which were shutting down the schools and ultimately issuing a shelter-in-place order in the city. And there was just a lot of confusion and conflict over who actually had the authority to do it. And as we now know, and as epidemiologists and public health experts were saying at the time, every minute that you wait in a pandemic costs lives. And so, if you are arguing when you should be acting, people are going to die. And that's basically what happened.
Right. But I wonder, though, Joaquin, whether a comparison between California and New York is entirely appropriate. I mean, you bring this up in your article as well. San Francisco's population is obviously a fraction of New York City's and not as dense in most areas. And of course, New York City has that incredibly dense public transportation system. So did all of those sort of weaknesses of New York City's, at least when it comes to a pandemic, just pose a more significant challenge to Cuomo and de Blasio than that California faced?
Sure. Yeah, it's not a perfect comparison by any stretch. San Francisco is the second most dense city in the state, in the country, but it's not nearly as dense as New York City. That's true. What we wanted to show, though, with our story was really timing of action based on what we knew around how the virus was moving. And if you just look at the number of cases that, were present in California when they issued important things like in San Francisco, the local emergency order, at which point they had no cases. When they issued the shelter-in-place order, they had somewhere around 40 cases or fewer than 40 cases. The numbers were much, much different in New York. And so the evidence that, there was community spread at that point was pretty clear. And so that's why, and we wanted to show that, part of what accounted for that delay was the relationship between mayors and their own health experts. As we showed in the story, there was quite a bit of conflict between Mayor de Blasio and his own health department, and then quite a bit of conflict between him and the governor. And in California, there was just a lot less of that. And all of the Bay Area counties were able to kind of act in a concerted way and collaborative way, sort of under the leadership of Governor Newsom, who thought it appropriate for counties to rely on their own experts and act in the way that would be most effective in protecting the people that live within those counties. So, while yes, California and New York are much different places, the fact is, leaders have to act based on what they know, and based on, what they knew in California, they acted more aggressively. And in talking to epidemiologists about it, they told us that there was just no question that California timed its response better than New York did.
Yeah, and we are now coming to see that even those small delays have had an outsized effect on how the pandemic spread in New York. Well, Joaquin Sapien with ProPublica, thank you so much for joining us and sharing your excellent reporting with us. We really appreciate it.
Well, thanks for having me. I really appreciate it.